Get serious for a moment. You know, here's the thing. If you were unexpectedly hurt or killed, would your loved ones know how to make decisions for you? Advanced care planning is a really important step, and everyone should take this to make sure that your choices are very clear. Joining me now, we have Jamie Bueller, the Director of Advanced Care Planning with Community Hospice of Northeast Florida, and Rick Graf, who actually went through this process. Did I say your last name's correctly? I'm so sorry, Bueller. Okay. So I want to talk to you a little bit about this. First of all, you know, going through this process, obviously very difficult. Can you tell me a little bit more about it?
Well, the importance of advanced care planning is to make sure that you've expressed and communicated your wishes. Ideally, you should talk to family and friends so that they know what you want if you were faced with a sudden or serious illness, so that your physicians and health providers know what you want, and so that the person who has to step in and make decisions for you will make decisions based on those wishes. We have facilitators who are trained to guide that conversation, and Rick is someone who went through that process with a facilitator.
And that's really what I was asking is just, you know, I mean, tell people what you don't want them to have to go through that you did have to endure.
Right. Well, really the most difficult part was deciding that you had to do it and realizing how important it was. But once we went through the facilitation, my wife and I went through the facilitation with Jamie. Jamie asked us about our experiences with advanced care planning, what we had gone through with our parents, and how that sort of colors what we want to have done. We talked about different medical scenarios and situations and what that entails. We even talked about our religious and spiritual beliefs. And through the facilitation, Jamie helped us understand what choices would be best for us.
And Jamie, I mean, nobody wants to do this regardless. Obviously, it's way better to do this beforehand. And there's something that's called a healthcare surrogate that is part of this process. Can you tell me a little bit more about that?
Sure. Florida law allows us to name someone who would make decisions for us when we lack capacity, and that person is a healthcare surrogate. It's usually someone who's close to us, who understands our wishes, and we know would honor our wishes and make decisions based on what we want, not what they would want for us.
One of the reasons that you guys are here today is because this weekend is really National Healthcare Decisions Day. Why is having that day so crucial?
Well, the day started in 2008 in Virginia, and it started small, and over the years it's grown and developed, and now it has become a national event. It's interesting that it's on April 16th, following Tax Day. Coming out of Virginia, it's based on Ben Franklin's quote, something along the lines of
death and taxes.
Death and taxes. So that's how the event has come to be. The importance of the day is to bring awareness to the advanced care planning and how important that is for all individuals, particularly those of us who are young and healthy, and what the resources are out there so that people know that they can put this in place and then they have peace of mind.
Now, when you went to do this, did it cost you anything?
No.
And that's the thing.
Yes.
Did that come as a surprise to you?
A little bit, yes. And for really the expertise you get and the knowledge that you get going through the facilitation process, I'm really glad that we did it. It's not something I would want to try to do on my own.
No, and that's the thing. It is free, and a lot of people don't realize it's free. Tell me about some of the other services that are offered as well that come free as a part of this.
Well, as part of advanced care planning is the facilitation. We do have all of the documents. We have a lot of resource material. Often when we're having a conversation, the individual wants a little more information, say, for example, on CPR or on dialysis or tube feeding. So we have developed a lot of resource material. All of that is also on our website and is free to anyone who wants to access the information.
Wonderful. Thank you guys so much. And I again apologize for mispronouncing your name.
That's okay.
And if you're interested in any of the events on National Healthcare Decisions Day, we have a link to learn more. It's on the morning show page of news4jax.com. Highly suggest that you check it out.